Hi all again. This is a message for a lot of seekers, that is clients, who probably need answers as to what does hypnotherapy do differently than a psychotherapy, or are they the same? The truth is, psychotherapy works at the level of the mind, and that is the conscious level of the mind. Meaning, there are three levels of the mind. One is conscious, one is subconscious, and one is the unconscious mind. Conscious mind is the mind where you see humans behaving, talking, and reacting or acting to circumstances. So whatever we see on the outside happening, and wherever we are focusing the attention right now, that is done by the conscious mind. The subconscious mind is the part of the mind where, since our mother's womb, whatever experiences we have been having, it's stored in that part of our subconscious mind as programs. You can say, like in a computer, there are many files. The subconscious mind has many files, programs. Certain programs are positive, certain are negative. Both programs work and get triggered in a conscious mind as per the circumstances at hand. Example, if there is a negative program of fear of driving, and the incident had been in your past where, while crossing an intersection in a car, you were hit by another car. That fear gets instilled in some people so deep that whenever they are crossing an intersection now, it triggers the conscious state of mind while driving a car, and their hands might sweat and their breathing might be a little faster. They might get a little more hyper alert and nervous, and they'll be more extra careful before they cross the intersection. So that is how there are subconscious programs, which are the ones which trigger acts in a conscious state. So whatever we are thinking consciously, acting consciously, is triggered by those programs. The unconscious is something which we are exposed to at night in dream state, or sometimes there are extreme emotional conditions or situations taking place in a person's life where a person starts blurting out certain things, most of which the person was never aware of, was repressed and stored in that third level part of the mind. And usually it's said that the third part of the mind is the largest, and we repress a lot of things. Repress meaning we do not let our conscious mind say or do a lot of things, and then that gets repressed into our deep unconscious state. So these are the three levels of the mind. So what talk therapy, and that is all psychotherapies, most psychotherapies do is, it works from your conscious mind to bring changes to the programs existing in the subconscious mind. Because subconscious mind programs are also habits formed. So to change those habits, new habits are consciously developed, learned, become aware of, which eventually results in a change of habit in your subconscious mind. Now, what does hypnotherapy do? Hypnotherapy helps in relaxing the conscious states of the mind and directly works with the programs in your subconscious state. Now, remember this. The subconscious programs, positive or negative, cannot be erased and replaced by only positive programs. The negative program impacts can be reduced or rather diminished, and a new healthier program can be instilled through hypnotherapy, and certain more modalities, even in psychotherapy, now exist. The modalities like EMDR, The modalities like mindfulness, being aware of everything, it's almost similar to a meditative technique. Then there is something called a somatic body work, where again a person is given a guided imagery and guided beautifully into visualizations and going deep within oneself, which is very similar to hypnotherapy. So, this is how, when psychotherapy is integrated with modalities like hypnotherapy, and now a lot of modalities in psychotherapy exist, which has hypnotherapy and deep levels of states established to bring more quicker, faster, and more consistent changes in people, it helps better rather than using psychotherapy alone. With 20 years of my experience in these fields, being a psychotherapist, being a hypnotherapist, being a past life regression therapist, I can vouch on it that a combination integrated modalities work far more profound on a lot of issues. But of course, there are individual differences present. For some, it'll only be one modality which is more impactful, and for some, it's the other one. So I'm not saying that hypnotherapy is far more excellent and like the best modality one can have over psychotherapy. No. For some, psychotherapy shall work, and for some, hypnotherapy shall work. But when the problem is very deep rooted, age old, years, and of high intensity, I would 100% recommend a combination modality than psychotherapy alone, because it will take more time and years for that person to reach the same state which a person can reach faster with combination and integrated modalities. The reason I came up with this video today is because I can see now that a lot of practitioners have started using more of combined methods, but not many are still using it. And I encourage all professionals who are offering psychotherapy to actually start integrating and combining lot of other energy healing, holistic, and alternative modalities, bring it into their practice, and help clients in the best way possible. Blessings to all of you. Take care.